Hey doctor, we got a case in AE with head injury with active bleeding. His BP is around 70/40 and heart rate is 130 per minute. On X-ray, patient is having femur fracture and the fast sign is positive. What do you suggest, doctor?
We have to initiate MTP, doctor.
What is MTP, doctor?
In A, we call it as massive transfusion protocol, doctor. Which means we have to check 6 points in MTP. So the first point is we have to check whether the patient needs MTP or not based on two scoring systems. One is ABC and one is TRAS scoring. In ABC, we check the heart rate, BP, and fast sign should be positive and trauma history. Whereas in TRAS scoring system, we check BP, heart rate, hemoglobin, and trauma history, excess base and bone fracture, any history of long bone fractures. Well, in this case, we have a long bone fracture history. So once you found the patient needs MTP, it should be you have to aware that more than 3 units should be transfused in 1 hour, or else more than 10 units of transfusion should be occurred within 24 hours.
Okay.
So coming to the second point, that is we have to activate the institution MTP protocol. That is by calling the blood bank and we have to make sure the blood bank staff should be aware of the case. Coming to the third point, that is optimize the intrinsic coagulation. To avoid hypothermia, we use blood warmer to all IV fluid and blood products. And injection tranexamic acid should be given 1 gram IV over 10 minutes, followed by 1 gram in infusion of over 8 hours. Coming to the fourth point, that is arrival of cross-matched blood products. So we have to give, once we get the products, we have to give it in a ratio of 1:1:1 or 1:1:2, which means 1 unit of plasma, 1 unit of platelet, and 1 unit of RBC or 2 units of PRBC. This is to avoid the dilution coagulopathy. And most MTP includes 10 units of cryoprecipitated or fibrinogen 4 gram in amount. So coming to the fifth point is rechecking. We have to recheck the patient CBC and ABG, creatinine, electrolytes, and fibrinogen levels. So we have to monitor, and as well as we have to monitor the hyperkalemia, hypocalcemia, hypomagnesemia, and if needed, we can replace with the potassium and magnesium parenterally to avoid cardiac arrhythmias. Finally, the sixth point is the arrival of other blood products. That is, this is based on the patient deficiency. So if the patient fibrinogen level is less than 1 gram per liter, we have to replace it with fibrinogen or cryoprecipitate. And if platelet should be more than 5,000, or in case of head injury, which means in your case, platelet should be maintained more than 10,000. And followed by we can check the INR should be, if INR is less than 1.8, we can go for FFP. The main thing is complication MTP. This is very important because the most common complication is coagulopathy, which has more cause of a mortality rate, and other complications are TACO and TRALI. So TACO means transfusion associated cardiac overload. You will get the face puffiness in patient, so immediately you have to stop the MTP, and if needed we can go for diuretics. And another one is TRALI, which means transfusion related acute lung injury. Patient will get a ARDS picture clinically, and this TRALI you will get it within 6 hours of transfusion. So immediately you have to stop the MTP. Once you get the ARDS features, we have to go for, if needed, we can give anti-HLA antibodies. So these are the things we have to check in MTP protocol.
Thank you so much, doctor.
Thank you.